Hi again, folks. Dr. Mike Breen here. I'd like to take a couple minutes just to talk to some of you out there who are interested, confused about the circumstance of type 2 diabetes. This is a really significant issue in our culture. The incidence of type 2 diabetes continues to rise in spite of the conventional attempts to treat it. Really, type 2 diabetes is a lifestyle disease. We've gone past the point of seeing these things as genetic-based issues that really people come to think there's nothing they can do about. In fact, type 2 diabetes is precisely the opposite of that. A little tiny bit of history, a number of decades ago, this condition used to be called adult onset diabetes. And it was called that, quite honestly, because it was a disease that was associated with adults and the consequence of exposure to high blood sugar levels for long periods of time. So after years and decades, in some cases, of high blood sugar levels, people would get to the point where their insulin production would start to subside. Basically, you get insulin fatigue, and they would then need to take secondary insulin to keep them alive, quite honestly, and to control their blood sugars. The condition's no longer called adult onset diabetes, it's called type 2 diabetes, and the reason being, quite honestly, is that it wasn't limited to adults. There were children as young as 8 and 10 years old who were getting this condition. And it was, again, the exposure to very, very high sugar diets from birth, more or less, up into a point where they were getting insulin fatigue at a much, much earlier age than what was previously identified in culture. So really it's about taking control of sugar consumption. Our culture drives sugar into our bodies as a part of the behavioral and cultural effect, and we've really done ourselves a terrific disservice. It's a difficult thing to change, there's no question about that, and that's why the Healthy Transformations program involves a behavioral change coach and behavioral change modification. Christopher Lawrence is involved with me in this aspect, and it's been a remarkably important thing. I can tell you this, that we have had a number of people who were insulin-dependent type 2 diabetics who no longer take insulin, simply as a consequence of controlling blood sugars through dietary modification and lifestyle modification. These people have come off and their lives have changed remarkably. So I want you to take home this message. If you're in this circumstance, whether you are insulin dependent or whether you're diabetic but not requiring insulin yet, or if you've been identified as pre-diabetic, which basically means you're heading down that pathway and that's where you're going to end up, please get in contact with us, because there is a lot that you can do. Your fate is not sealed. You can change this circumstance. It takes some work, but you'll be very, very happy that you took the step to do it. So thanks very much. We'd be very happy to help. Take care.